It's hard to believe, but in 2022, diabetes was the 8th leading cause of death in the United States.
Diabetes is on the rise in the U.S. More than 30 million people have it, and millions more are at risk of developing it.
Well, diabetes is a serious disease, and it can lead to very serious complications: blindness, amputation, kidney disease, heart attack, and stroke.
Over 101,209 people lost their lives to this disease. What's even more troubling is that the number of people with diabetes is increasing rapidly. Diabetes might become the 7th leading cause of death by the end of 2024. This means more families will face the pain of losing their loved ones. This chronic illness kills more people than breast cancer and AIDS combined, causing blindness, kidney failure, heart attacks, and more. It nearly doubles the risk of a heart attack, and living with it is a constant fear. The economic impact is staggering, costing the United States $412.9 billion annually, with $306.6 billion in direct medical expenses. It's not just a health crisis, it's a financial black hole. But why is managing diabetes so costly? There is no simple answer. However, we'll uncover the shocking truth about how diabetes is draining billions of dollars from our economy. It's time for us to face the facts and think about what we can do to fix this problem. The choices we make today will affect our future. Join us in this documentary as we explore the serious impact of diabetes, what it means to Americans, and its overall worldwide impact. Let's not wait until it's too late.
And diabetes is like the Black Plague of the 21st century. It's a pandemic worldwide.
A mysterious illness. Over 3,000 years ago, the ancient Egyptians noticed a strange illness. People would urinate a lot, feel very thirsty, and lose weight. Today, we know this was likely type 1 diabetes. They tried to manage it with a diet of whole grains, hoping it would help. In ancient India, people found a unique way to test for diabetes. They would present urine to ants. If the ants were drawn to it, it meant the urine had high sugar levels. They called this condition 𝗪𝗛𝗡𝗪, which means honey urine. It was a clear sign of what we now understand as diabetes. In the 3rd century BCE, a man named Apollonius of Memphis used the term diabetes. This might be the earliest mention of the disease. Greek doctors later differentiated between diabetes mellitus and diabetes insipidus. Though both cause thirst and urination, only diabetes mellitus involves problems with insulin. Diabetes insipidus, on the other hand, is caused by issues with a hormone called vasopressin, produced by the pituitary gland. The ancient Roman doctor Galen also wrote about diabetes, but noted it was very rare. He had only seen 2 cases, indicating how uncommon it was back then. By the 5th century CE, doctors in India and China realized there were 2 types of diabetes. Type 2 was more common in wealthy, heavy people, hinting at a link between overeating, inactivity, and the disease. Today, with easy access to processed food, the connection between wealth and diet is less clear, but obesity, bad diet, and a lack of exercise remain risk factors for type 2 diabetes. The name diabetes mellitus combines the Greek word diabetes, meaning to siphon or pass through, and the Latin word mellitus, meaning honey or sweet. This name paints a vivid picture of the condition's symptoms. In the Middle Ages, people thought diabetes was a kidney disease, but in the late 18th century, an English doctor discovered that it often occurred after an injury to the pancreas. In 1776, Matthew Dobson confirmed that the urine of people with diabetes tasted sweet. He measured the glucose in their urine and found it was very high. Dobson also noted that diabetes could be fatal for some, but chronic for others, helping to distinguish between type 1 and type 2 diabetes. By the early 19th century, no one knew how common diabetes was. There were no effective treatments, and people often died within weeks or months of showing symptoms. But today, diabetes is more than just a word. It's a heavy burden on millions of lives. Shockingly, 8.7 million Americans didn't even know they had it. The risks are huge. from ancient remedies to modern science. In the early days, treating diabetes wasn't about pills or shots. The ancient Greek doctors thought riding a horse might help because it could cut down on how often you needed to use the bathroom. Over the years, there have been many strange and hopeful remedies. Doctors tried all sorts of diets, like milk with rice to make the blood thicker, or barley water boiled with bread. They even suggested eating veal and mutton or green vegetables. Some ideas were truly odd, like using rancid animal food or even narcotics like opium. There were many other treatments too. Some experts thought certain chemicals could help, like ammonium sulfide or lithium salts. Others believed in lifestyle changes, getting lots of exercise, wearing warm clothes, taking baths, avoiding stress, wearing flannel or silk, and getting massages. Despite all these efforts, people with diabetes often faced severe health issues. Then came a breakthrough that changed everything. In 1889, two scientists, Joseph von Mering and Oskar Minkowski, discovered that dogs developed diabetes when their pancreas was removed. This finding was a big step in understanding how the pancreas controls blood sugar. Then in 1910, Sir Edward Albert Sharpie Schaefer suggested that diabetes was caused by the lack of a special chemical from the pancreas. He named it insulin. The name comes from the Latin word for island because the cells in the pancreas that produce this chemical are in tiny clusters called islets. The real game changer happened in 1921. Frederick Banting and Charles Best, working with other scientists, found a way to extract insulin from the pancreas of healthy dogs and gave it to dogs with diabetes. This reversed diabetes in the dogs, and it marked the discovery of insulin. By January 1922, a 14-year-old boy named Leonard Thompson was the first person to receive an insulin injection. This gave him 13 more years of life, though he eventually died of pneumonia. But for people with diabetes, insulin was a life-saving discovery. In 1936, Sir Harold Percival Himsworth made another significant discovery. He found out that not all diabetics were the same. Some people had insulin resistance rather than a lack of insulin. The pancreas has to work extra hard to produce more insulin because insulin resistance prevents the body from using insulin as intended. This causes stress and damage to the pancreas. These early struggles and discoveries remind us how far we've come in understanding and treating diabetes. From horseback riding to insulin injections, the journey has been long and often heartbreaking. It goes without saying that today we have better ways to manage diabetes. The cost of ignorance. When the pancreas fails to produce enough insulin or the body can't use insulin well, it leads to diabetes. This condition causes high blood sugar levels, which over time can seriously harm the body's systems, especially the nerves and blood vessels. Children are affected by it too. About 2 million Americans have type 1 diabetes, including 304,000 children and teenagers. There's also a condition called prediabetes that affects 97.6 million American adults. If not managed properly, it can turn into type 2 diabetes. Older people are especially at risk. Nearly 30% of Americans aged 65 and older have diabetes. That's 16.5 million seniors dealing with this disease. Every year, 1.2 million more Americans are diagnosed with diabetes. And the cost of diabetes is huge too. In 2022, the total cost of diagnosed diabetes in the United States was $412.9 billion. Of this, $306.6 billion went to direct medical costs, while $106.3 billion covered indirect costs. Back in 2017, the cost of diabetes to the US healthcare system was $237 billion, a 26% jump from 2012. The burden keeps growing. Globally, the picture is just as grim. The number of people with diabetes went up from 108 million in 1980 to 422 million in 2014. The high global burden of diabetes strains individuals, healthcare systems, and entire nations. In 2021, global health expenditures on diabetes surpassed $966 billion and are projected to exceed $1,054 billion by 2045. The costs keep climbing with no end in sight. These harsh realities highlight the urgent need for effective prevention strategies, early diagnosis, and proper management of diabetes. Imagine a future where the cost of your healthcare is so high that it feels impossible to manage. that future might be closer than we think. A new report from Senator Bernie Sanders paints a worrying picture of what could happen if drug prices keep rising. According to the report from the Senate Health, Education, Labor and Pensions Committee, if half of the Americans with obesity started using Wegovy and other similar weight loss medications, it could cost $411 billion each year. That's more than what Americans spent on all prescription meds combined in 2022. Wegovy is the main medication driving this cost. The report also says that if half of all Medicare and Medicaid patients who are obese took these meds, Medicare and Medicaid could end up spending $166 billion a year. It comes close to matching the amount they spent last year on all prescription medications. Senator Sanders is very concerned. He says the high prices of Wegovy and other weight loss drugs could bankrupt Medicare and the whole healthcare system. He warns that these costs could lead to much higher health insurance premiums for everyone. Adding to the worry, the Danish company Novo Nordisk, which makes both Ozempic and Wegovy, charges Americans far more than people in other countries. For example, Ozempic costs $969 a month in the US, but only $155 in Canada, $122 in Italy, $71 in France, and $59 in Germany. Wegovy costs $1,349 a month here, but only $186 in Denmark, $137 in Germany, and $92 in the UK. Senator Sanders has written to the CEO of Novo Nordisk, 𝗪𝗙𝗪𝗏, complaining about these high prices. He points out that these prices are putting a heavy strain on Medicare and Medicaid and making it hard for many people to get these needed drugs. It's a tough situation. Earlier this year, the North Carolina State Health Plan for teachers and state employees stopped covering Wegovy because Novo Nordisk wouldn't lower the price. Over 35 state Medicaid programs don't cover Wegovy, and many states have limited coverage for Ozempic due to its high cost. Sanders understands that these drugs are important for people with type 2 diabetes and obesity, but he believes they're only helpful if people can afford them. He also mentions that it costs less than $5 a month to make these drugs, yet Americans are paying up to $1,340. This huge price difference feels unfair. The high cost of these drugs might lead to a major healthcare crisis. We need to find a way to deal with these rising costs before it's too late. It's interesting to think about how we see diabetes and the coronavirus pandemic. Both have changed many lives around the world, but we often think about them in very different ways. Diabetes has been with us for a long time. It's a chronic disease, which means it's something that people live with every day. In 2024, about 537 million adults around the world have diabetes. This number is only going to get bigger. By 2030, it's expected to reach 643 million, and by 2045, 783 million. Diabetes can cause serious health problems like blindness, kidney failure, heart attacks, strokes, and even the loss of limbs. Despite these serious issues, diabetes doesn't always make the headlines. Maybe it's because it's been around for so long and people have gotten used to hearing about it. On the other hand, the coronavirus pandemic hit us suddenly and spread quickly. Since it started in late 2019, over 704 million people have gotten sick and more than 7 million people have died as of April 2024. The virus moved fast and its impact was immediate and obvious. It was all over the news and the whole world was trying to find ways to stop it. But now, as we get better at dealing with the virus and it becomes part of our everyday lives, it's not in the news as much. Even though it's still here and still affecting people, we don't hear about it as often. Both diabetes and COVID-19 have changed the way we live. Diabetes is a long-term battle, and COVID-19 was a sudden shock. But both need our attention and effort to manage. It's easy to forget about these health problems when they're not in the news, but they are still here, still affecting millions of people. We need to stay aware and keep working to understand and manage these challenges. It's important to remember that just because something isn't making headlines, it doesn't mean it's not important. Diabetes quietly impacts millions every day, and even though COVID-19 isn't the main character anymore, it's still here. Both diseases remind us that health issues are a constant part of our lives, and we need to pay attention even when the world seems to move on. Access to affordable care and treatment is crucial for all those living with this relentless disease. The World Health Organization has stepped in with the Global Diabetes Compact, aiming to reduce diabetes risk and ensure that everyone diagnosed has access to equitable, comprehensive, affordable, and quality treatment and care. The journey of treating diabetes has been long and difficult. It began with ancient remedies, where healers used herbs and hope. Over the centuries, people tried many different methods, learning from their mistakes along the way. Now, we're on the edge of a new era, and modern science is offering new solutions that once seemed impossible. The evolution. Back then, managing diabetes was a daunting task. People had to follow extreme diets with almost no carbohydrates. It was a tough and painful way to live, but then a ray of hope emerged in the form of insulin. Insulin changed everything. It allowed people to lower their blood sugar levels effectively without the need for such strict diets. This breakthrough was just the beginning. Over the years, insulin has improved to last longer and be more stable. One of the notable improvements was NPH insulin, introduced in 1946, which is still used today. In 1955, the first oral medication for diabetes came into the picture. It was called 𝗪𝗙𝗪𝗏𝗪𝗏. This was a big deal because it offered another way to manage blood sugar levels. Soon, other medications in the same family followed, like chlorpropamide and glipizide. In 1957, Europe saw the introduction of metformin, an insulin sensitizer. The United States welcomed it later in 1955. Until the early 1990s, there were only 3 types of meds to treat diabetes: insulin, sulfonylureas, and metformin. But things were about to change. The mid-1990s brought a wave of new oral medications. Alpha-glucosidase inhibitors like acarbose and miglitol arrived, followed by meglitinides like natronide and repaglinide. And these helped manage blood sugar but didn't last long as SUs. The late 1990s and early 2000s introduced thiazolidinediones, which were powerful insulin sensitizers. However, these came with problems. Troglitazone was withdrawn due to liver toxicity, and rosiglitazone was pulled from the market because of heart safety concerns. Pioglitazone stayed, but its side effects like swelling and heart failure limited its use. As we entered the 21st century, diabetes treatment options expanded even more. Human insulin analogs and pramlintide were introduced. In 2006, DPP-4 inhibitors like sitagliptin and saxagliptin made their debut. These meds increased insulin levels and reduced glucagon secretion. The late 2000s brought more innovative treatments. Colesevelam and bromocriptine, both with unique mechanisms, were introduced. But after that, we saw the introduction of GLP-1 receptor agonists and SGLT2 inhibitors. GLP-1 receptor agonist meds like exenatide and semaglutide increased insulin secretion and reduced glucagon secretion. They also helped with weight loss. In 2022, a combined GIP and GLP-1RA were approved, showing even better results. SGLT2 inhibitors like dapagliflozin work by promoting glucosuria, lowering blood sugar levels, and providing heart and kidney benefits. These meds transformed diabetes treatment and were recommended for patients at high risk. Today, the primary goal of all these medications is to lower blood sugar. Insulin, GLP-1RA, and dual GLP-1RA, GIPRA are very effective. TZDs, SUs, and metformin also have high efficacy. SGLT2 inhibitors offer intermediate to high efficiency, while DPP-4 inhibitors and others provide intermediate efficacy. These advancements have improved the quality of life for diabetes patients, reducing symptoms and increasing their lifespan. However, with a longer life expectancy, new challenges have emerged. Patients are now more prone to complications like heart disease and nerve damage, and it makes the prevention of these complications a key goal. The journey with diabetes medication has been long and challenging, but the fight against diabetes continues. And this new era is nothing short of astounding. The technology of our time has advanced so much. We're getting very close to beating diabetes, and it's definitely worth taking a closer look at. The new era. In the last 10 years, the world of diabetes care has been transformed. There was a time when managing diabetes meant a constant battle with insulin injections and painful blood tests. That era is slowly fading as technology brings hope to millions. We now have continuous glucose monitoring systems that offer near real-time glucose readings. These devices don't just measure glucose, they talk to advanced insulin pumps. Together, they make decisions about insulin delivery based on glucose trends. This combination, known as hybrid closed-loop systems, is changing lives. It's like having a personal assistant for your diabetes, one that helps adjust insulin automatically, needing only occasional manual boosts around mealtime. The result? Better glucose control and fewer dangerous lows. But there's more to this story. Using insulin pumps has been linked to fewer cardiovascular events and even a decrease in the risk of death. The numbers are heartening, showing that these tools are not just about better sugar control, but potentially about a longer, healthier life. And while right now these technologies are costly and mostly used by those with type 1 diabetes, there is hope. As technology evolves and costs drop, they might become accessible for people with type 2 diabetes as well. In the quest to perfect diabetes management, the ultimate goal is clear: developing implantable glucose sensors and fully automated insulin delivery systems. These systems would use artificial intelligence to keep glucose levels steady without any human intervention. With AI's help, we might soon have precision care that's tailored to each individual or even to large populations, estimating risks and improving outcomes. Another significant change in the field is telemedicine. This wasn't as common before, but the COVID-19 pandemic forced many to adopt it quickly. Telemedicine has brought the convenience of remote consultations, allowing patients to manage their diabetes more effectively from home. It's been a game changer, especially for those who struggle with frequent clinic visits. But it's important to remember, telemedicine has limits. It can't replace every in-person visit, especially for complex cases requiring a physical exam. However, precision medicine stands as a beacon of hope. This approach tailors treatments based on individual differences in genes, environment, and lifestyle. It's the opposite of a one-size-fits-all method. For diabetes, though, this approach is still finding its footing. While it holds promise, especially compared to the more defined field of oncology, diabetes care is complex and often relies on factors like comorbidities and medication side effects rather than the unique characteristics of each patient. Yet, there remains one final frontier in diabetes management: islet transplantation. This could be the key to restoring natural insulin production and reducing the need for frequent insulin injections. Probably we're heading towards a future where we no longer have to worry about insulin levels because our body could regulate them naturally. Both pancreas and islet cell transplants offer hope, but they come with challenges. The need for lifelong immunosuppression to prevent rejection and the current shortage of donors are significant hurdles. Right now, there is no cure for type 1 diabetes. People with this condition must manage it day by day. They rely on medications and other resources to keep their blood sugar levels in check. For those with type 2 diabetes, research is ongoing and there's a glimmer of hope on the horizon. China has reached a major medical milestone. They have successfully cured a diabetes patient. Yeah, you heard that right. Using a groundbreaking cell therapy, a patient no longer needs insulin injections after just 3 months of treatment. This news might sound like a miracle to those who've been living with diabetes, constantly taking medications and insulin shots. Chinese scientists have done something remarkable. They've developed a new treatment that's changing lives. A team from Shanghai Jiangxing Hospital, the Center for Excellence in Molecular Cell Science, and Renji Hospital has achieved this feat. Their findings were published in the journal Cell Discovery. The patient underwent a cell transplant in July 2021, and within 11 weeks, they no longer needed external insulin. If you or someone you know has diabetes, you know how tedious and painful those insulin shots can be. Over the next year, the patient slowly reduced their oral medications for blood sugar control. Eventually, they didn't need those. Follow-up exams showed that the patient's pancreatic functions were restored. How did this happen? The new therapy involves programming the patient's blood cells. These cells transform into seed cells, recreating pancreatic islet tissue in an artificial environment. This might sound complicated, but here's the simple version. Our bodies need insulin to keep blood glucose levels stable. The pancreatic islet tissue has beta cells that release insulin. Diabetes makes these cells stop working and the body stops making its own insulin. This is why patients need external insulin and constant monitoring. But with this new cell therapy, some of the patient's blood cells can be transformed into seed cells. These cells function like the beta cells in the pancreatic islet tissue and release insulin. This means a diabetes patient wouldn't need to rely on external insulin anymore. It's like giving the body a chance to heal itself. This approach is part of an emerging field known as regenerative medicine. This new treatment could be a game changer, especially for China, which has the highest number of diabetes patients in the world. About 140 million people in China have diabetes, and 40 million of them depend on lifelong insulin injections. This cell therapy could significantly reduce this burden. It's hard not to feel a sense of sadness when thinking about all those who've struggled for so long. But with this new development, there is a glimmer of hope. Maybe, just maybe, we're on the brink of a new era in diabetes treatment. One where people no longer have to live in the shadow of this relentless disease. The myths. We've all heard myths about diabetes, and it's time to set the record straight. These misunderstandings can be harmful, so let's talk about the real facts in simple, clear terms. One of the biggest myths out there is that eating sugar directly causes diabetes. It's not that simple. Eating too much sugar can make you gain weight, which is a risk factor for type 2 diabetes. But sugar itself isn't the main culprit. Studies have shown that drinking soda regularly can increase your risk of type 2 diabetes, even if you don't gain weight from it. But this doesn't apply to other drinks like diet soda or fruit juice. On the other hand, many people believe that only those who are overweight get diabetes. While being overweight is a risk factor, it's not the only one. According to the CDC, 11% of people with type 2 diabetes in the US are not overweight, and type 1 diabetes has nothing to do with weight at all. Even though obesity increases the risk of diabetes, it doesn't guarantee you'll get the disease. The CDC says that while nearly 40% of US adults have obesity, only 13% have diabetes. Yes, people with diabetes need to watch their diet carefully, but this doesn't mean they can never eat sugar. The American Diabetes Association says it's okay to enjoy small treats on special occasions. It's all about balance and planning. And it's scary to think that diabetes always leads to blindness or losing a limb, but that's not true. If you manage your condition well, those outcomes are rare. Only about 11.7% of adults with diabetes have some vision loss, and less than 1% have amputations. Moreover, some think that people with diabetes shouldn't exercise, but that's absolutely wrong. Exercise helps manage diabetes by lowering blood pressure and helping the body use insulin better. It's important to monitor blood sugar levels during exercise to stay safe. Diabetes is not contagious. It's not something you can catch from someone else because it's not caused by a pathogen. It's a non-communicable disease, so don't worry about spreading it. Diabetes is a complex disease, and myths can make it harder to understand and manage. Knowing the truth helps everyone stay informed and healthy. If you have diabetes or know someone who does, learning the facts can make a big difference. The hidden dangers. Sometimes you feel like you can't stop eating even when you know you should. This isn't just about liking food. It's called food addiction, and it can lead to big problems like diabetes. Food addiction isn't just a love for food. It's a serious problem that can make you eat more than you need. People with food addiction often choose unhealthy foods and eat too much, which can cause weight gain and poor health. Eating too much sugar can also lead to low blood sugar after meals, making you feel weak and shaky. This is especially common in people who are overweight or have just been diagnosed with type 2 diabetes. On the other hand, exercise helps keep our weight and blood sugar in check, but without motivation, it's easy to skip. Finding activities you enjoy and setting small, achievable goals can help. Support from friends and family can make a big difference too. If we don't stay active, we risk gaining weight and increasing our chances of getting diabetes. We often hear about diet products that promise to be healthy, but some of them might be doing more harm than good. Artificial sweeteners found in many diet or sugar-free foods can actually lead to weight gain and mess up our blood sugar levels. They might even harm our gut health. These fake sweeteners can contribute to the development of type 2 diabetes. Some supplements, like those with green tea extracts, can damage the liver, making diabetes even harder to manage. All these factors, food addiction, lack of exercise, and fake food, can play a role in developing diabetes. It's essential to eat a balanced diet, stay active, and make healthy lifestyle choices. Remember, taking small steps today can make a big difference tomorrow. Plan that works for you. What you eat significantly impacts your blood sugar. It's not just about the type of food, but also the quantity and combinations. Balanced meals are essential. Methods like carbohydrate counting and the plate method can help manage this balance. Carbohydrate counting involves tracking your carb intake since carbs convert to sugar. Opt for healthier carbs such as fruits, vegetables, and whole grains over processed foods like white bread and candy. The plate method is simpler. Fill half your plate with non-starchy vegetables, 1/4 with lean protein, and 1/4 with healthy carbs. Pay attention to portion sizes, such as keeping a serving of meat to the size of a deck of cards. Balance your food intake with your diabetes medicine to prevent dangerous blood sugar fluctuations. Limit sugary drinks, reserving them for quick blood sugar boosts when necessary. Exercise helps lower blood sugar and improve insulin use. Aim for at least 150 minutes of moderate activity weekly, such as walking or swimming. Follow a schedule that aligns with your meals and medicine. Check your blood sugar before, during, and after exercise, especially if you use insulin. Have a snack if your blood sugar is low before exercise, and carry quick sources of sugar like glucose tablets. Stay hydrated by drinking plenty of water. Diabetes medicines, including insulin, are essential when diet and exercise are insufficient. Proper timing and storage are crucial for insulin effectiveness. Keep insulin away from extreme temperatures. If your medicine causes low blood sugar, consult your doctor about adjusting the dosage or timing. Always consult your healthcare team before starting any new medicines, including over-the-counter ones. When you're sick, stress hormones can raise your blood sugar. Have a sick day plan, including which medicines to take and how often to check your blood sugar. Continue your diabetes medicine, but contact your doctor if you can't eat. Stick to easy-to-digest foods like crackers and soup, and drink plenty of fluids. If you use insulin, sugary drinks might be needed to prevent low blood sugar. Alcohol can cause low blood sugar soon after drinking and for hours afterward. Consult your doctor before drinking alcohol. Limit intake to 1 drink a day for women and 2 for men. Eat before or while drinking to prevent low blood sugar. Choose light beer or dry wine and use sugar-free mixers. Check your blood sugar before bed and have a snack if needed. Hormonal changes, such as those before and during your period, can affect your blood sugar. Track your levels to anticipate these changes and talk to your doctor about possible adjustments to your diet, exercise, or medicine. If you're nearing menopause, check your blood sugar more often. Stress can also raise blood sugar. Practice relaxation techniques, exercise, and consider working with a psychologist or social worker to manage stress. Living a healthier life is not just about feeling good now, it's about ensuring long-term well-being. A healthy lifestyle can prevent illness. Eating more fruits and vegetables and exercising can lower your risk of diseases like type 2 diabetes. For example, eating more fruits and veggies daily can reduce your diabetes risk by 25%. Regular exercise can also extend your life. Being healthy improves your daily well-being. Eating nutritious food, staying active, and getting enough rest can enhance heart health, strengthen your immune system, and increase your energy. Imagine waking up feeling full of life and ready to take on the day. Mental health is equally important. Exercise, a balanced diet, and sufficient sleep can help manage stress, reduce anxiety, and improve your mood. Healthy habits also provide more energy. By staying active and eating well, you'll feel more awake and productive, able to tackle daily tasks with vigor. A healthy lifestyle can save you money. Treating chronic diseases can be very expensive. By staying healthy, you can avoid those costs and keep more money in your pocket. Additionally, healthy habits can extend your life by over a decade compared to those who don't follow such practices. Imagine adding 10 extra years to your life by making a few simple changes. Living healthily also benefits the planet. Eating more plant-based foods reduces carbon emissions and conserves resources, contributing to a better world. So, living a healthier life isn't just about feeling good today. It's an investment in your future, your finances, and the planet. The real question is, why wouldn't we choose to live healthier? Breaking down barriers. Diabetes is a challenge that affects many aspects of life, especially for those facing socio-economic disparities. It's heartbreaking to see that diabetes doesn't affect everyone equally. Research reveals that people from racial and ethnic minority backgrounds, as well as those with lower incomes, are hit hardest. Just imagine the weight of knowing that your financial situation or where you live can increase your chances of developing diabetes by up to 40%. This isn't just a statistic. It represents countless lives made more difficult by circumstances beyond their control. Limited access to nutritious food, necessary medications, and monitoring tools can make managing diabetes feel like an uphill battle. And the struggle doesn't end there. Without health insurance, preventive care becomes almost impossible, leaving many without the support they need to stay healthy. This documentary has thoroughly examined the multifaceted nature of diabetes and the arsenal of strategies available to combat this chronic illness, which claims millions of lives and saddles not just America, but the entire world with an increasing financial burden. Diabetes is not merely a health issue. It poses a significant economic threat that could potentially overwhelm our healthcare system. As the prevalence of diabetes escalates, so do the associated costs, impacting not only healthcare but also workforce productivity and overall quality of life. By embracing healthier lifestyles, we can play a crucial role in preventing the onset of diabetes, managing it more effectively, and alleviating the financial pressure on our healthcare infrastructure. This collective effort transcends individual responsibility, requiring a unified approach to foster a healthier and more stable future for all. The pressing question remains: are we prepared to make the necessary changes before it's too late? Despite technological advancements, we find ourselves in a relentless cycle as the number of individuals diagnosed with diabetes continues to climb steadily. This alarming trend could soon position diabetes as the leading cause of death worldwide, with dire implications. If diabetes ascends to this grim status, the financial strain of managing and treating the disease will become insurmountable, transforming it from a personal health challenge into a looming global crisis. Therefore, it is imperative for each of us to act now. If you're watching this, you have the power to make a difference. Share this message, raise awareness, and advocate for the normalization of regular physical activity and balanced diets. The battle to prevent a future devastated by diabetes is one we can still win, but it requires our collective effort to change the course of this narrative. Together, by promoting healthier lifestyles and advancing research into potential cures, we hold the key to turning the tide and shaping a better future. Thank you for joining us today. If you found this video helpful and want to stay current with the latest advancements in diabetes care, please subscribe and click the notification bell. Share this video with your loved ones to spread awareness and contribute to the cause. For those in need of reliable storage for insulin and other medications, visit our website through the link in the description to explore our top quality cooling solutions. Have questions or insights on diabetes management? Leave them in the comments below. Let's continue the conversation and support one another in our journey towards a healthier future. Remember, knowledge is power. Together, we can make a difference. Thank you for watching, and see you in the next video.